have to establish your center, like who you are and what you're available to give to someone, and then understanding that you might not be able to help them.
Hello, and welcome to the Physical Preparation Podcast. I'm your host, Mike Robertson, and I'll be joined on the line later today by Dr. Sarah Martin, or as Bill refers to her, Dr. Sarah. Now, before we jump into this week's episode, real quick, I just want to say Happy New Year. My friend, it is 2021, and look, let's be real here. There is no way 2021 can't be immeasurably better than 2020. So I just want to say Happy New Year to you. Thank you so much for being here. I love and appreciate you, and I thank you so much for listening to the show. Now, normally this is where I would do the whole, hey, weekly recap thing. Here's what's going on in my world, and I promise very, very soon I will do that, and I will give you the world's longest update about what's going on in my world. But in the interest of getting all these shows produced before the holidays hit, well, I'm kind of recording all of these in a very batch fashion. But to make it valuable to you, I am giving you 5 tips over 5 weeks to help make sure 2021 is your best year ever. So this is our 4th week, and if you didn't listen to the previous episodes, week 1 was all about setting goals, both process and outcome-based goals. Week 2 was all about finding accountability, hiring mentors, hiring coaches. Week 3 was all about getting back on the horse. You know, failure is part of the process. So when you fail, get back on the horse and get back to work. This week is all about learning to be patient. And this is a lesson I don't think I ever thought I would learn. You know, I was in my early 30s. I was successful by just about any stretch of the imagination. And man, patience was just not a thing that I learned. And luckily for me, I had this revelation in the form of kids. And if kids can't teach you to be patient and to be calmer and to control whatever kind of urges you might have in your life, then I don't know what will. But when you're setting goals for yourself and when you're hiring coaches and mentors, you have to find this blend of you want to be aggressive in your nature. You want to set aggressive goals. You want to make sure that you're challenging yourself. But you also have to be patient and think about playing the long game. And this is something that I think a lot of people make the mistake of. A lot of young coaches and young trainers, they say, oh man, I want to be an expert in 3 years. And, you know, just grind. They're on Instagram, they're on YouTube, they're going to courses or they're watching courses. Like, that's great. I love that process and I love that mindset. But you also have to understand, like, you can't force the results. And sometimes there's this balance between knowledge and acquiring all this knowledge and getting experience. And you just can't make up for the experience and the reps that you get in the gym. And this is something that Dr. Sarah and I talk about at length. You know, when she was getting into this pelvic floor space, she wasn't an expert, but what made her so good was the fact that, you know, she was humble, she continued to learn, but most importantly, she got a ton of reps in, and she just kind of said, I don't know all of these things, but I'm going to try a lot of stuff out. And it's okay if I fail. Again, coming back to week 3, you know, you're going to fail, but being okay with that and knowing that that is part of the process. So I think this is something that we can all improve upon. You know, there's very few of us where we can raise our hand and say, no, I have an acceptable level of patience. And that's okay. Right? Again, we need that certain level of aggressiveness. We need to be able to push when it's time, but we also have to think about the long game. And it's not about being the best trainer or coach in 1 year or 3 years. It's like, how can I be the best trainer or coach over the next 20, 30, 40 years? That's the kind of game that I want to play. And it's hard sometimes because I think that goes against our nature or our natural intuitions. But at the same time, if you can take that step back, if you can have that bigger perspective, then I think it's a lot easier to be patient and know that, hey, man, I'm not trying to win in this short-term sprint. I'm trying to win in the long game and play this game as a trainer or a coach or as a rehab professional for as long as I possibly can. And I think just shifting that mindset can be a really powerful tool to help make sure 2021 is an awesome year for you. Okay, with that being said, we're going to take a quick break, and then we're going to jump into this awesome new show with my girl, Dr. Sarah Martin. It seems like almost every day I talk to a young trainer or coach who is frustrated. Maybe they're frustrated with the results they're getting. Maybe they're frustrated because they don't have trusted resources to learn from. And maybe they're frustrated because they simply don't have enough clients and wonder how long they'll be able to stay in the industry. So if this sounds anything like you, I've got something that I know will help. My Complete Coach certification was created for trainers and coaches just like you, who are serious about the results they get and know that becoming a better coach can directly translate to a bigger bottom line. This certification is going to take the last 20 years of my life's work and put it all into one massive course. In it, you'll learn how to use the R7 system to create seamless, integrated, and efficient programs for clients and athletes of all shapes and sizes. How to create the culture, environment, and relationships with everyone you train so you can get the absolute best results. The exact progressions, regressions, and coaching cues I use in the gym, from squatting and deadlifting to pressing and pulling and everything in between. And last but not least, I've added an entire section on my assessment process and how to use that to write programs faster and more effectively than ever before. Of course, there's a ton more that I cover, but that should give you a pretty good idea of what the certification is all about. Now here's the thing, spots for the certification will open twice per year for a limited time only. If you're interested in learning more, my next certification will launch in March 2021, and if you join my free insiders list, you'll be able to save $200 when it opens. To get on the insiders list, just head over to CompleteCoachCertification.com. Again, CompleteCoachCertification.com, and then stay tuned for our launch emails coming very soon. Thanks so much for your support, and I hope you'll pick up a copy of the Complete Coach Certification when it launches. Dr. Sarah Martin graduated with a PhD in neurobiology from the University of Kentucky in 2008. She then returned to UK to pursue an education in physical therapy, graduating in 2014. As a PT student, she was the recipient of the American Physical Therapy Association's Mary McMillan Award. In addition to general sport and orthopedic-based physical therapy, Sarah is specially trained in women's pelvic health and has been treating patients with these symptoms for over 5 years. Sarah incorporates her sports and strength training background and her continued training in biomechanics, breathing, neurology, and manual therapy to successfully treat her patients. In this show, Sarah and I take a deep dive into a normally taboo topic, the pelvic floor. Obviously, we discuss the physiology and need to understand that area, but we also discuss her assessment and treatment approach as well. And last but not least, we talk about more general topics, like the value of getting real-world experience and getting reps versus simply trying to learn all of the things on the internet. The pelvic floor is an area where I, and I'd imagine many others, don't have a lot of experience. So I hope you'll take some things away from this show, and it will also spur you on to learn more about this critically important topic. But enough for me, let's do this. Dr. Sarah, thanks so much for coming on the show here today. Super excited to have you on. Could you start by just telling us a little bit about yourself?
Yeah, absolutely. Thank you so much for having me. This is a really cool opportunity. So yeah, I'm just gonna keep it real short on this part because there's so much good stuff to talk about. So I am a physical therapist. I work out of Lexington, Kentucky. I do have a specialty in pelvic floor and women's health, which often kind of go along with each other, but we do more than just women's health with pelvic floor. So that's good to note. Yeah, I treat everybody. I treat almost everybody. I do a lot of pelvic floor, but anything else that walks into our clinic. I'm lucky to work in a really cool clinic. And so we see more specialty stuff. I can't really tell you how many knee joint replacements. I wouldn't trust, if one of my family members was going to have a knee replacement, I would ask them not to come to me because I just don't do it.
Right.
Right.
So
that's really cool to be able to do really cool types of things in PT. So that's kind of anything weird, I've probably seen it.
That's awesome. And what led you to the world of physical preparation? How did you get started in this whole space?
So let's take it back to 2003.
Yeah.
And I was actually my organic chemistry partner. He was into lifting, and I was like, that sounds cool. Yeah, I'd love to try some of that. And so he actually introduced me to T Nation. Yeah.
Oh, yeah.
And so I started reading and lifting and read a whole bunch of your stuff, Bill's stuff, well as all sorts of stuff.
Right.
And yeah, it was more of a hobby. I started learning, and then I mostly lifted to get my, it's a hobby through grad school and to get strong for rugby. And then I hurt myself. I dabbled in powerlifting, and I hurt myself. I had a knee injury. And so I had a really crappy PT. And so then I hightailed it up to Indianapolis, 3 hours away. I was like, I think these guys might be able to help me. And so, yeah, and absolutely. So then I started working with Bill first, and then, you did a whole bunch of programming for me. And I thought, this is actually really cool. And so then, I started going to more classes and, coming up for courses just out of pure curiosity and just to get better. So that's how the physical prep stuff went. And then, did some strength coaching on the side here and there for fun.
So what about the PT stuff though? What made you, was it, because I'm always interested by this, right? I always knew I wanted to get stronger, and I wasn't seeing results doing the old school bodybuilding stuff.
Right.
So that's what made me want to go into this. Was it in part due to that crappy PT that made you want to go into physical therapy?
Oh, so with the career stuff, it was really interesting. So yeah, I went and saw you guys, and that was a really cool experience. And I had all this stuff, and in my head, it was still this hobby that I happened to be kind of good at.
Right.
And so I was working. So at this point, I was a postdoc. So I'd finished my PhD in neurobiology because, just
that light
extra
work.
Time.
Light
yeah,
work.
Exactly. And I'd be working in my lab. So I was a postdoc. I'd be working in my lab, and I'd have lab techs come in, and they were like, hey, can you look at my shoulder? Hey, what should I do for this and that? And they would just, and I'd answer their questions and stuff. And so one day, one of the other scientists in the lab that I worked with, she just looked at me, and we were pretty good friends, so it caught me off guard. She just looked at me, and she just goes, what are you doing here? I was like, well, working, doing science. And she's like, no, seriously, what are you doing here? You should be doing that. Look at your passion, essentially. And that day I was like, well, she might have a point, because I really love the research. I love research, but the in and out day of being a research scientist is
mundane.
Is intense. Yes, exactly. It's super mundane. It's a lot of books on tape, that kind of stuff. And it wasn't working with people. And so I marched down to the PT department, which was one building over, and was like, hey, so, how can I apply? And they were pretty much just just put in your application. It's cool, and so I did and got accepted. And yeah, and then the first line of business, I think probably first day of PT school, I'm, marched down to the office of the people who do internships. And I was like, hey, look, I'm going to do an internship with Bill Hartman. Otherwise I quit. I'm done. But seriously, I think that was super important to me, that having that bad PT experience, I think showed me there's a good way of doing this, and there's everybody else. And so I definitely didn't want to be, if I, stopped a whole career to do this, I was going to make sure I was going to do it my way. So
yeah, I love it. I love that story. So let's dive in and talk a little bit, because like you alluded to, you have a really unique niche in pelvic floors that I want to spend some time and focus on today. Yeah. So let's start with a really easy question first. How did you get started working with patients with pelvic floor dysfunction?
Yeah, so kind of lucky. I was doing some stuff right out of PT school in the gym, in a gym setting, just doing the stuff that I learned from Bill, straight up postural restoration stuff,
right?
And banging it out, doing a great job, getting people better. And I decided I also wanted a little something else, more stable, not just in the gym, a clinic position. And as luck would have it, one of the clinics here in Lexington, the owner was interested in PRI. And she happened to also do pelvic floor physical therapy, and she asked me to interview. And so I met with her, and she's like, I really think PRI is cool. I want someone here who does it. I also, we do pelvic floor health or pelvic floor physical therapy, and I really think that they would go really well together. And would you be interested? And, at that time, like I had one class out of PT school, one day, seriously, they like dedicated a whole day to pelvic floor physical therapy. And so, it was like, I don't know, it was probably, if I would have thought about it too much, I probably would have said no. You know what I mean? I was like, well, cool. Yeah, let's do this. What I was attracted to was the clinic. I was going to have one-on-one, my own treatment room. So I figured, small price to pay for being able to do PRI my own way and, treat in a good clinic. And so that was the start. I did not realize what I was signing up for, but I'm glad I did. It's been a really, really cool journey. And with it, I've been able to, and being in that clinic, especially like both of the senior physical therapists have been therapists for like 20 years, which is kind of rare.
Yeah.
To really be able to work with people who've been doing what they want to do as PTs for years. So they have a huge DO background as well as visceral. So I learned a ton of visceral, then that's where like you get into the organs, working in people's abdomens, which is really interesting. And as well as some of the biomechanics stuff. So it was pretty cool. It's been pretty cool to be in that environment.
And how long have you been there?
Almost 6 years.
Oh my gosh.
Might be. Yeah, exactly.
My gosh, that's crazy.
I know.
That's crazy.
Time.
It literally seems like 2 years ago that you were with Bill. So talk to me, like over those 6 years, like how do you go from a generalist, right? Like you have this basic broad skill set to, hey, and not to mention that one day of PT school where you really got all of the pelvic floor knowledge. But how do you go from that to where you're at now? Like what kind of work did you have to do on the back end to kind of get yourself up to speed?
I think Bill and I kind of talked about this recently. It's the day in and day out.
Yeah.
It's the not like what I ended up doing, kind of going back, is like I was doing a few things. I was teaching, at UK for their PT program. I was doing stuff in the gym, and I decided, you know what? I'm going to learn PT. I'm going to learn to be a clinician. And so I dropped everything into that basket, and I said, I'm going to put my focus here. Honestly, I kind of, besides I went to some pelvic floor courses, and which was of course, really helpful, for starting. But what I did was almost through necessity because of, starting a family and all that kind of stuff. I just went into the clinic and I treated every day, and I stopped reading so much. Not that it was bad. I didn't have time. But what it ended up doing, I think, is it made me stop overthinking things and just using what I had. I was lucky that I had a really great base of information that I got from, being an intern with Bill. And I had surrounded by these other PTs who were really good at what they did. And so I just used what I had for a long time.
Yeah.
And just developed the watching. And it's funny, my boss now, she calls it fiddling and diddling. And that's it. Like, okay, This isn't working. I'm not going to read and see, what am I doing wrong? I'm going to try something else. And so, and it works in physical, you know what I mean? It works with everything, absolutely. But especially in that pelvic floor realm where there's not a lot of answers out there. There's not a lot of people with all the right answers. And so I did have that space to be like, you know what, I'm this person's last hope. They've been to, this many doctors. I can't really mess them up anymore. So I'm just going to see what works. And I did that for a long time. And I tell you what, it was the best thing that I did. Even though I thought that I thought I was doing myself a disservice of like not, seeking out all the knowledge and constantly reading and.
Yeah. It's such a great point, and it's something that I try and really impress upon young coaches these days because, again, you and I are of a certain age. You're younger than I am, but like when I was coming up, there was so less knowledge to be had, right?
Right.
Like the internet was sort of a thing, but if I really wanted to dig into something, I had to order a book or a VHS tape or go to the library and print out research articles. So like knowledge was so much harder to come by, so you just would go in the gym and it was okay to experiment versus now there's this like stigma, like, oh, you don't know what triple block periodization is, like, oh, well, what are you doing with this entry level athlete? Like, come on, man. Like, you need reps, you need experience. Not to say the book knowledge is not important or unimportant.
It is.
But you have to find a balance between the two.
I agree. And that it's everyone wants the thing that they can put on Instagram that's like
Yes.
new and cool and they know all about it and they know all the background. And it's like sometimes it's just like, I don't know, it just works, and playing around with it and learning later and coming back to it. But yeah, exactly. I think that there's just the reps. And I think that's what really helped me grow into, I think, the PT that I am now.
Yeah. Yeah. I love that. Okay. So I'm going to go a little out of order here because we kind of already talked about anatomy. We talked about the one day that you had. Like when I was coming up, we literally never discussed the pelvic floor ever. Now, granted, I'm not trained as a PT, but never heard about the pelvic floor, never learned about the diaphragm in 6 years of undergrad and grad school. Like it wasn't a thing.
Right.
I think you and I can agree they're pretty important. So would you just break down the pelvic floor for us a little bit and maybe explain the role that these muscles play in our body?
Right. I think one of the interesting things why you don't hear about it, no one wants to talk about peeing, pooping, and sex. And you know what I mean? Like, and so I think that's been from a poor concept of the pelvic floor. I think that's been the idea of it. Even when you look at like the pudendal nerve is the shameful, it means the shameful nerve. And so it's just like, oh, we don't have to talk about it. We can't see it. It works, whatever. Step back, all of a sudden, people, we realize that it's more than that. So when you look at the basic pelvic floor function that we do kind of talk about, you've got, bowel and bladder control, sex, and those are kind of the big things. But then as a bipedal erect person or human, the pelvic floor became something even more. And this is where I think like people right now in the strength coach of business are really interested in is that it's a postural muscle too.
Right.
And so without your pelvic floor, if you were to have any pressure in your system, lifting anything off the floor, your organs would fall out underneath you because we have a literal hole like in the bottom.
Right.
You know what I mean? Like in the bottom of our torso, which I don't think people realize that it is a hole.
Right.
And the pelvic floor is what stops everything from coming out, which, if you're a dog, it's not a big deal. You're on all fours, so you don't need to use it as such. But having all of those roles, just like the diaphragm, right? Breathing, posture, it gets confused. And so you start to it can be used in like other in a compensatory way for standing, moving. And so then when it starts to play a compensatory role for other things, you can start having issues with kind of your basic bowel bladder functions. And you work into pain and stuff like that. And so the pelvic floor is super fascinating. And the anatomy is interesting too. It's a little bit more complex. There's a lot there. So I'll kind of skip over that today. But when it comes to function, it's huge. And so one of the things that I always talk about is the relationship, as people are starting to talk more about the diaphragm, there's this direct relationship between the diaphragm and the pelvic floor. So as you breathe in, so in a situation, an ideal situation, as you take a resting breath in, the diaphragm drops down, right? It flattens out, and it pushes down onto your internal organs, which is good because that's mobility.
Yep.
And then your pelvic floor drops down with that. And so they're both descending at the same time with a relaxed breath. And then as you breathe out, they both ascend. So you get this pump system that works that should be working at rest all the time.
Right.
So that's a huge thing to know, because if you don't have that, nothing else matters with the pelvic floor. You can do Kegels till the cows come home. Nothing's going to help you if you don't have this resting proper mobility that is supposed to exist in the pelvic floor. Goes along with the diaphragm.
That's fascinating. Okay, so now a not so easy question. Could you explain, at least in part, why we're seeing so many issues with the pelvic floor these days?
Oh, yes. So first, let's start with the fact that people are willing to talk about it now. So you have people finally like shouting from the rooftops, hey, this pelvic floor is here and there's a lot of dysfunction. People are experiencing a lot of dysfunction. So we have women are finally coming out and saying, hey, like, yes, I have incontinence after my kids, and yes, my mother said she had it, my grandma said she had it, and they all say it's normal, but I don't want that for myself.
Right.
I think that I'll give it to women and how they've gone from essentially just being like moms and kind of letting their body be moms to being like, after I had these babies, I want to still work out. I still want to have, I still want to have my strength. I still want to feel good.
Yep.
And so I think that they stopped being okay with the answer of this is just how it is. And so I don't know that we're seeing, I don't know that part of it is that we're not seeing more. We're seeing people like address it and want it addressed. Now, on top of that, with the pelvic floor is super integrated in the autonomic nervous system. And so when you think about stress, we don't think about the pelvic floor, but it is a huge part of stress and managing stress. So I think, you might be seeing an increase, people having increased issues with their pelvic floor with increased stress, of course, poor lifestyle choices, all that kind of stuff.
Sure.
Like everything that you see, all these first world, social media, computer, all of those problems, you're seeing it now, like you're seeing it in the pelvic floor just because of how integrated it is with stress and lifestyle. And then to add another fun component is kids. So I've been starting to learn, I'm taking a course this weekend. I've been treating some kids with constipation issues and noting part of them missing developmental milestones. And so I don't do any kind of, like when I'm treating a kid for pelvic floor, like we don't do any kind of internal exams or anything like that. I do what you guys do. I watch them crawl.
Right.
I watch them move. I watch them breathe. And, we get these kids better because I teach them, I have 11-year-olds crawling.
Yeah.
And, like really relearning how to use their body, because what they did, I always say like our bodies, humans are amazing. They figure out how to get it done. Through evolution, like you're not going to just stop and not do. Your body's going to figure it out, but it might figure out in a way that, makes pooping really hard.
Right.
And so, I wonder sometimes how much just the lack of kids having really good time to develop themselves physically. And that's probably something that you've seen, from when you started, how kids come in with a base level of athleticism and where they are now and what they're coming in with now. That's what I'm seeing. And so I wonder if we're now, causing a lot of pelvic floor dysfunction early. So
that's crazy. And it's such a great point, because I think there's a certain time and a place to just get the job done, right? And like there's a task, go achieve it. But strategy is important, right? And that's something you don't hear people talk about it a lot. I know Bill talks about it. To hear you say something along those lines, maybe not surprising, but yeah, strategy is so important. And it's always amazing to me how resilient human beings are. Like we will figure out a way to get something done, but that doesn't always mean the strategy is going to be optimal for the long term.
Right. And exactly. That's exactly it. And you don't want to take away that, humans are amazing and figure it out. But when it starts to cause serious issues, whether it be, a lack of ability to, from easy stuff, especially for kids, like a lack of ability to enjoy sports or enjoy physical activity, to all the way down to like can't pee or can't control urine, having constipation issues, that it's no longer okay.
Right. Right. So this actually kind of leads me into my next question. For somebody that is not familiar at all with this space or knows nothing about the pelvic floor, what are some reasons that somebody might come see you as a pelvic floor specialist?
Absolutely. So we always think of the obvious, people already kind of know of the obvious of like, incontinence, having either urge where you feel like you have, as soon as you feel like you have to go to the bathroom, you're losing urine, or stress incontinence, losing urine with jumping and all that kind of stuff. As I mentioned, I treat people with constipation issues, so that comes into my office a lot, as well as pain. So pelvic floor pain, which this is the big, newsflash. This isn't just females. Like, men have pelvic floor pain, and even especially actually in an athletic population. So I've been seeing a guy recently, 22, pelvic floor pain with lifting.
Really?
Yeah. Oh, absolutely. And so these are things that, I think because of that kind of root of like shameful or not wanting to talk about it, you don't hear people say it sometimes, and that's what I think strength coaches need to be so aware of, is that if someone's quitting, or stopping, or they don't want to do something, sometimes it's because they don't, and you don't know why. Maybe they didn't want to tell you,
Right.
And so it's really important to note. But also endometriosis, or IC, interstitial cystitis. So I also see actual, different disorders that can be treated with PT, which is crazy.
That is super cool. So here's something I'm really interested to learn. When it comes to a patient that's dealing with some form of dysfunction, what does your assessment process look like?
Right. So because the pelvic floor has that major postural component to it, my assessment is definitely going to be, at first, very similar to what you're going to see in Bill's office, right? Yep. You're going to see me measuring hips. You're going to see me looking at the diaphragm. I'm looking at how people breathe. I'm looking at where are people compensating that potentially is getting in the way of them properly using their pelvic floor. Okay. So that's just your general basic screening. But then depending on the situation. So here's another, thinking about skills that you develop with what you do, because the pelvic floor is such a charged area. Everyone comes in and you kind of have to establish where that person is emotionally. So with where you're going to go next, right? Because it's easy to do, like moving their arms and legs and stuff, but, and that's going to, I could have in one day, a 45-year-old nurse who has pelvic floor pain as well as incontinence, and you know what I mean? And has this history of people trying to fix it and messing everything up. And then I'll have, a 28-year-old first baby strength coach, just having some issues with lifting. And then, a guy, like my 21-year-old male who can't lift without pain, so how the first thing is talking, and, Bill always talks about the rap, your rap. And so my rap's really interesting now and very nuanced. And so, some people come in and they don't know why they don't know why they were sent there. So there's a lot of unraveling of what the pelvic floor is, why this might be helpful. And then, like I said, you kind of do this basic assessment. And some people, that's it. I can tell enough about what's going on that I might not have to go any further. But a lot of times with the people that I see, that I'll do an internal exam. And essentially what I'm looking for, so with women, it's vaginally. And so you go in, and the cool thing is this is kind of the nerd part of it. Imagine being able to actually feel the diaphragm move.
Right. Like
to put your hand inside someone's body and feel what the diaphragm is doing. That's what you can do in the pelvic floor. Right?
Right.
So as they breathe, you can feel what that pelvic is doing with the breath, the pelvic floor is doing with the breath. Is it properly descending with the diaphragm? Is the diaphragm descending? You can watch all that and feel. So then also take, there's a lot of surgeries happen in the pelvic floor. So I'm looking at scarring and how that might be affecting things, muscle tone, asymmetries. Talk about knowing, really feeling an asymmetry. An internal exam can give you that information so quickly. So, because it's obvious to me. I don't know. During PT school when they had me palpate an elbow, I don't know what I'm doing.
Right.
But now, with the pelvic floor, it's just so easy to see if you can have one side that's descending with the breath and the other side that isn't.
Wow, that's crazy.
It's cool.
I guess I never would have thought of that. Okay, so let's take that a step further. You've gone through the assessment process.
Yes.
You've come up with your diagnosis or your treatment plan to start. what do you do? I mean, obviously, you're probably going to have some local stuff, but if you have things that maybe lie outside of the scope, like you're doing something, I don't know, for their chest walls, right? Or some remote area of the body, how do you explain to them that like, hey, look, there's a local and a global piece, and we've got to integrate all of that back together? How do you sell that to them?
Oh, so this is where my job's way easier.
Okay.
So with pelvic floor patients, of course, with my other patients, you have to do a lot of selling points, but imagine just think about everything that you do. If you have someone that's where their knee hurts, you're having to sell breathing, right?
Right.
Well, I don't have to sell that. It's like right in that little package. And so what I always do is address the issue that your pelvic floor should move, and it needs to move with your breath. And so that's foundational. And so my job is to find the position that can happen. And so as we talked about compensation, so I have to figure out what position I can put them in to help them not use their pelvic floor in a compensatory fashion. How can I get them to reestablish this proper motion? And so that's where I use my assessment and decide at first, my first thing is I just try to figure out, I use the assessment to see, okay, where's the most probable position for them to reestablish this good pelvic floor motion, and that's a lot of the stuff that you hear, the intensive stuff that Bill does. And then, wide versus narrow, all that kind of stuff. Sometimes it works and sometimes it doesn't. And that's what Bill would say too. I mean, not everyone comes in as this perfect picture. Someone would be like, they might be a narrow rib angle, let's just say, and you're like, oh, quadruped. Oh, I've had two knee replacements. I will not get on my knees. You know what I mean? It's like you're constantly shuffling and being like, okay, what's a good position for you? And finding that, even if it's sometimes suboptimal. So I get them positioned to be able to really find that motion through their pelvic floor. So that's always first. Then this is kind of what you're speaking to. Then we have to build on that. And so that's where I might be doing some stuff that seems odd to them, whether it be a hip shift. But again, because I can do the internal exams, they can feel it. So if you have a tight side of your, let's just say you have pain on the right side of your pelvic floor and it's really tender, put them in a shift on the table and let them feel how, now all that relaxed. Right. So like I said, that's the one area that I actually have a little bit of an advantage. So then I'm big in for my work. As Bill, as you and Bill were saying, strategy is important. So I always give them a really good, solid foundation, because if I skip that, if I go into anything fun, Instagram fun, it's over. And so you have to establish foundations. And so I think that's the part that people hate and think are boring. And why does, it's hard to make a cool Instagram video about it, but you really have to establish this proper motion. And so we do that first. Well, then you have to progress it and help them learn how to keep that while doing other activities. And so that's where things can get a little hairy, not hairy really, but taking them to a new place that maybe they didn't think that they were going to be going, with being able to build up to be able to use proper strategies where the pelvic floor is being used as a properly in its postural role, so then it can also have its roles in everything else being used well.
Interesting. And so how has your approach changed since you did the intensive? And I know Bill's changed a lot of stuff over the years since you were a student, but how has your treatment model, or maybe the positions you use, evolved since going through that, or has it?
Yeah, that's a great question. That's a super fun question, because I really, when I had started and, like I said, did a lot of that work between when I was an intern with Bill and when I went to the intensive. I was looking at all of this stuff, really, I was like, people need to relax, because I was having feeling these pelvic floors and working and realizing that the PRI, or that the positional stuff a lot of times was so aggressive, and trying to force these positions, and it wasn't working. And I was like, this isn't working. So I started essentially, putting people in positions to help them relax. And like supporting them, doing a ton of support and doing a lot of belly work and like manual work in people's bellies and being like, well, it's manual. I know I'm, quote unquote, not supposed to be doing it, but it's working. It's helping people.
Right.
And so understanding that like the internal organs have motion and that you need to respect that, and they need that motion to be a functional organ. So the colon needs to move to be functional. And so this is all the stuff that I was learning. And then I went to the intensive just interested and not, like I said, I hadn't done a ton of, like I followed videos here and there of Bill's, but I just didn't have time to really dive into what he was doing. I go to the intensive and I just kept looking at him and being like, oh yeah, this. He can tell you. I was like, oh yeah, I see that all the time. This is, I've been doing that too. So a lot of it was nice because it was this aha moment of, yes, this is what's been working for me. The cool part, of course, that Bill brought in was he brought it all together.
Right.
And so I think sometimes I was treating things as separate components when not kind of thinking, okay, this is all related, like how someone's gut is moving is related to how their hips are moving. And this is what I might be able to do about it. And so just getting that fuller image of the whole system together
yes,
was a huge aha moment for me in the intensive. And then again, it's so funny. And then taking it and creating, being able to help people a little bit more, being able to find that position that was going to let their pelvic floor go a little bit further. And so that's it really took my treatment up a huge notch right away. So like getting much better results really quickly, which was really cool because I had all the back knowledge. I didn't have to like think in my head, oh, so why the liver moves? What? Right. I wasn't in there doing that. I was like, yes, I got that. Come on, let's put it all together. And so that was super, super cool. And yeah, so that's definitely, the intensive helped me like find better positions faster.
Yes.
And really, like I said, put it all together as one thing for me.
I love it.
Yeah.
So I try to keep the show relatively hate-free. But I think one of my pet peeves is when some random internet expert says, you just need to do blank. And that could be in any realm. But in this realm, it's like, oh, pelvic floor dysfunction, you just need to do Kegels for your pelvic floor issues. Yeah. So whether it's the random internet expert or a first-time patient coming to you, how do you go about explaining your approach and why Kegels may or may not help them with their issues?
Yeah. That's such a good one. And yeah, the hate for, you love anyone trying to help people, but when anyone simplifies it to the ridiculous, it's very frustrating. Or saying, oh, you don't need to know anything about the pelvic floor. Just have them do squats or, all that, whatever they're, I think squats are great. I'm not hating on squats. I think they're amazing, but just giving some flippant answer for a population that they really haven't dived deep into. And so that's a huge part of what I do. It's a ton of talking and educating. And so one of the biggest things is helping people know that their pelvic floor moves and that it's this muscle group. And yes, it's supposed to hold up your organs, but it also, you also need to have control over it to be able to do everything, all the other functions, all the kind of physiological functions that it's meant to play a role in.
Right.
And so, what I feel like I have to do, and for everyone it's a little bit different, but how to, kind of give the pelvic floor this deeper, more complex without speaking in a too complex way, of just kind of opening the door, of helping them understand all of the things that this muscle group is doing, and helping them know that they're okay. They're not the only ones, with this or that issue, and saying, okay, first we need to help you feel your pelvic floor and feel the motion that it's supposed to have, because you can't contract a muscle That's a lot of the example that I use. Like, you can't contract a muscle that's already kind of stuck in contraction.
Right.
And because that's what they'll say. They'll be like, I've done, let's just say it's just like a basic incontinence. Well, I do Kegels. I do them out every day and I get nowhere, Well, as I always use kind of like that basic like bicep, like, see, I can move my arm up and down, but if I have my arm up, I can't move it up anymore.
Right.
And so just those basic understandings of how your pelvic floor should move, which speaks to pretty much speaks to everyone.
Right.
And in this really, and then the support of it. And so then that becomes the next issue with people is how the pelvic floor shouldn't have this sustained pressure, because if you're using kind of a Valsalva, technique to stabilize your system, which is that kind of that bearing down, that pushing technique, all the time, that your pelvic floor is constantly trying to overcome it, because you're constantly trying not to squirt your organs, out of your rectum or your vagina. And so, helping people understand that and using very layman terms is super, super important.
Yeah.
And so, so hearing anyone say, well, you just need to do a Kegel, or just, inhale as you're doing this and exhale as you're doing that, as important as that can be with a pelvic floor dysfunction, if their pelvic floor isn't inhaling and exhaling with their diaphragm, it doesn't matter.
Yeah. Yeah.
And so
you brought up a couple points that I want to circle back to just real quickly. But number one, I can only imagine that as good as you have to be clinically at your job, like, your levels of empathy have to be off the charts.
Yeah, absolutely.
Yeah. I'm just imagining how personal of an issue this is, right? And my wife's a dietitian, so I kind of see that, because training is easy. Like, training's training. Like, maybe I see you 3 days a week.
Right.
Nutrition is something you do 3 to 5 or 6 times a day, right? The stuff that you're dealing with is stuff that you're doing multiple times per day. It's like an average human function that you expect to be there. And when it's not, it's an issue. So, I just wanted to circle back to that. Like, the amount of empathy that you have to have is probably very, very high.
It's insane. And, where some days, luckily, I work with really cool people who had to help me through it. Because at first, when I was I would come out of the treatment room emotionally exhausted.
Yes.
It felt too much sometimes, when you're hearing, trauma or even medical trauma, people who've been here or there, and then you're their last hope. You know what I mean? It puts you in this whole, how can I be their last hope? All that kind of stuff. And just really learning to ground myself in myself. And I know it's weird, but you have to establish your center, like who you are and what you're available to give to someone. And then understanding that you might not be able to help them, and that you're going to try your, kind of one of the things that, especially with some of the really complex patients that then ended up carrying over with everybody, that my coworkers taught me that have been doing this kind of work for a long time, is you're not going to be able to, you're going to give them what you got, and that's not going to hurt them. They might not get better, but other people have tried and haven't gotten them better either.
Right.
And so, it's okay. Essentially, it's okay to fail, as long as, you give them what you know. And if that doesn't work, then that's okay.
Yeah.
And in this line of work, that was so important to hear, because it's sometimes, and of course, the more I've gone on, the more I've seen, and the more I have been able to help, or even been able to give them and that's the other thing, it might just be one little thing that can help.
Yeah.
And you might not cure everything, but if you can give them just a little piece. And so just learning to establish to separate myself from the patient, and who my success from their outcomes was super, super important. But then to be able to come into every treatment, to be able to come into the treatment room and be kind to that person and really listen, because, they need to get their story out.
Yes.
And that's been a huge, huge component of just letting them get their story out.
I love that.
Yeah.
So the other thing that I wanted to mention, but this idea, you mentioned it up top, of relaxing in your resets. I think this is something that a lot of people have messed up in the past, or a lot of people don't give enough credit or credence to, but I feel like when it comes to breathing exercises, the more you're working, the less it's probably working, right?
Yeah.
Like I see this so often where people are like trying to force their body into a position versus relaxing into a position and trying to breathe through it. And I think that's something that you mentioned as well.
Yeah. And that was, like I said, that was a huge aha moment before I went to the intensive, and then just I got better at it, at helping people relax after the intensive, finding better positions, just from talking to Bill and kind of working with that. But you're exactly right. Like, it's something I've been actually thinking about, like even bringing it back neurologically. When you think about like Parkinson's disease, a disease that affects the basal ganglia. And we always, when you learn about it in school, you're like, so so essentially their system is always turned on. So all of their muscles are active all at once. And so when you have that, it's actually non-movement.
Yes.
We always, in the strength community for the longest time, and PT as well, it's always been about strengthening and, this strong component. But when you look at what movement actually is, it's inhibition. Mm-hmm. It's inhibiting the system. And that's why people with Parkinson's can't move, because they can't inhibit. And so everything's just on. And so kind of looking at it, with what we're trying to do, we're trying to create movement by getting their system to relax and inhibit, to then be able to put on good movement on top of it. But you can't put good movement onto a contracted system. You can't.
Yeah.
And so that's exactly it. And it's been really cool, hasn't it?
That's awesome.
To
really
absolutely see the difference.
Yeah. I just think back to when we first started employing breath work and all of that, and, just trying to fight and just muscle our way into these positions as meatheads, right? That's your avenue, right? I'll just muscle my way through this. And now understanding like, oh, maybe if I just chill out and relax, I can find that position a lot easier.
Mm-hmm. Oh, I can't tell you how many times I failed with a good old quadruped. Come on, higher, keep that arch,
right.
Big exhale. Just like, Oh man, I screwed so much stuff up.
Yes. Well, that's why we're here, to share all those mistakes. Okay.
Oh, totally.
Big question time. If you could alter the space-time continuum and give young Dr. Sarah Martin one piece of advice about training and or life, what would it be?
Don't take on so much. Don't take on so much. I definitely, even at the very beginning of my, after PT school, I was teaching neurophys and 2 other courses at UK. I was, working in this clinic. I was also working out of the gym, trying to do my private, this private clinic on the side, and I was pregnant.
Oh, wow.
Oh my gosh. And then I was wondering why I just couldn't, I wondered why I wasn't good enough. You know what I mean? And so I just wish I could go back and say, pick one thing and just do that. And it's okay if you don't know all the answers. You're going to live. Your patients are going to live. You're not a surgeon,
Right. I love it. Okay. Last but not least, we've got our lightning round. So 4 fairly short questions. Your answers can be as long or short as you'd like. Okay?
Okay.
Number 1, for the uninitiated, why does Bill call you Dr. Sarah?
Oh, yes. So I have a doctorate in neurobiology that I worked very hard for, and I like to think I still use it, but not in the conventional way. And then I also have a doctorate in physical therapy, the old DPT. So it ended up being a Dr. Sarah.
I love it. Okay. Number 2, how has being a parent changed your outlook on therapy or coaching?
I love this question because remember that, the empathy that we talked about. It's funny. I think Eric Cressy just put out, he had posted something. I think I saw it on Instagram. It was pretty much you can shove your 6 a.m. workout and your meditation routine. I have 2 kids fighting over a balloon and one trying to knock over the Christmas tree. Yes. So being able to come in with patients and, especially new moms, which I see a lot of new moms, and be like, you don't, just because the doctor said you can do a workout program in 6 weeks doesn't mean you should, and let's step back and let's, figure out when we can get this work in. And it's really interesting. A lot of times I'll see someone post I got this person better in a day. And I always laugh because, a lot of times with a lot of my parents, I mean, it might take 3 visits for us to figure out when they can get this exercise in and what position it can be in. Is it that they only have bedtime, like when they're physically in their own bed? Sometimes that's not when it is because they have a baby with them in their bed.
Right.
You know what I mean? So
Right.
It's just kind of knowing the ins and outs of parenthood has been awesome and
Yes.
definitely made me a better therapist.
Yes. Yes. You definitely learn patience. That's for sure. I didn't know if I'd ever learn that lesson. I'm still not totally sure, but I'm getting there.
Yes, exactly.
Okay, number 3. I know you're one of Bill's former PT students, which obviously holds you to a different standard. But with that being said, what are you excited to continue learning about in the future? Like, what's your Con Ed looking like for 2021?
Actually, right now it's been interesting. Like I said, I'm getting into this like PEDS bowel function stuff, which you think like, oh, that's how fun is that? But it's actually really cool because then I'm able to go back and learn a lot of the really dig deep in a lot of the neurodevelopmental positioning and how the pelvic floor and the diaphragm are developing over that time. And it really gives you a better understanding of the pelvic floor as a postural muscle, because these kids, they don't develop that pelvic floor as a postural muscle properly, like if they're having issues. And so then it also doesn't work as a functional muscle to have a bowel movement or anything like that. And so just getting into all of that has been really, really interesting. So yeah, that's where things are. Yeah, that's where things are going. So I don't know. We'll see.
I love it. That's cool though. Okay. Number 4, last but not least, what's next for Dr. Sarah?
I kind of alluded to it earlier, and I'm not going to give everything away, but my goal is to come up with something, and I'm working on it between having to take care of kids and all the other stuff. I feel like every time I get a good time to work on it, like, disaster strikes,
Yes.
A glass
Yes.
breaks, milk's everywhere,
Yes.
kids aren't sleeping, all that stuff. But I want to help strength coaches and non-pelvic floor PTs have a good, just enough information to know the language.
Yeah.
As well as being able to screen for some of this stuff and not to change it. And that's a huge thing. Like, I really think there's a know your role situation because,
Yeah.
we've already talked about like the empathy. Like, I've worked on that for years and have had good mentors in how to work with pelvic floor dysfunction. I don't think you need to be a pelvic floor therapist. I think that strength trainers and other PTs need to know what could be going on.
Yep.
And then also to develop a language with the patient that's really like harm avoiding, like how to say this. I'll never forget, like, another thing I wish I could go back on, all of the people, especially like women in that kind of like 45 and on, like when they don't want to do something, I always thought they were so mean about it. Like, I will not do that. And you can take your stupid exercise and, and go to hell.
Right.
And I was always like, why wouldn't you just try? I mean, like, it's just this or it's just that. Just try it. And I wish I could go back with everything that I know now and be like, they might have been afraid of shitting on the floor. You know what I mean? Like,
right.
You can't. They might have been afraid of something major, a major catastrophe. And here I am acting like
it's no big deal.
Yeah. And so, having the language of, hey, if you don't, starting from the beginning, if there's anything that you feel uncomfortable with, just let me know and we'll change it up instead of tell me everything about, oh, is that painful? Oh, it's not painful. Like it doesn't have to be the Inquisition. If someone doesn't want to do something, like be good enough, even make something up, and I think that's where like the newer PTs, newer strength coaches are like, well, if this is going to be the best thing, that's what you need to do instead of anything is okay. Like as long as you're not making the patient or the client, feel uncomfortable.
Right.
So.
Well, I can tell you whatever it is, product, whatever it comes out, I'll be the first to buy it because I think that it's fascinating. I'm always looking to educate myself, even if it's not, I think you do this long enough, right? You start a generalist, you become a specialist, and then you make it a goal to kind of come back to a general level as well, right? And so
Absolutely.
I'm always looking for the generalities and just looking to learn more. So definitely very cool stuff. And Sarah, I appreciate your time so much. Thank you so much for coming on today. Where can my listeners find out more about you and the great work that you're doing?
Man, I wish I was like super social media set up. I do have an Instagram account, and sometimes I do actually post like little videos there as well as like on a YouTube video thing. Okay. So Sarah, I think it's Sarah Martin. This is bad. Sarah Martin, DPT, PhD, I think is my Instagram account. Maybe I should check. And then
we'll find it. If not, we will find it.
Perfect. And like I said, I have a little YouTube channel that I put stuff on and just videos of, little things that I've learned and coached. And so, yeah, otherwise, I guess message me.
That's awesome. Well, again, Sarah, thank you so much for coming on the show. This was really great.
Absolutely. My pleasure. Thank you so much, Mike.
All right, my friend, that does it for this week's episode with Dr. Sarah. Really hope you enjoyed it. The pelvic floor is definitely not my strong suit. It's not my forte, but I also know and understand that it plays a critical role with regards to posture, breathing, and movement. So it's something that I've got on my list to continue to learn more and more about. And I think if you're playing the long game here, you realize you can't know all of the things about all of the areas of the body all at once, but at the same time, you make it a goal like, hey, I don't know enough about this area, but I know that and I respect that. And I know down the line, I'm going to make this a focus. It's going to be something I'm going to learn more about. So kind of agree with me. We got to make sure that Dr. Sarah gets this product or video or whatever it is done so that we can all learn more from her. So my friend, if you enjoyed this episode, I got one of two favors to ask. Number one, if you are not already subscribed, take 2 seconds out of your day and do that right now. Wherever you consume podcasts, iTunes, Stitcher, SoundCloud, Spotify, Google Play, Amazon, wherever you download podcasts, subscribe now so that you get each and every episode downloaded straight into your phone, tablet, wherever you listen to shows. If you already subscribed, go one step further for me. Give me a rating and a review on iTunes. This is the most surefire way to make sure that other trainers, coaches, and rehab professionals get exposed to the show. They get to listen to these amazing guests, and hopefully we make our industry a little bit better place. So my friend, as always, thank you so much for your support. Love and appreciate you, and we'll be back soon with our next episode. Take care.